Good day everyone. Today we will be discussing the topic of electric shock. So electric shock, it is a painful stimulation of sensory nerves which could be caused by sudden flow, cessation or the variation in the current passing through the body. So it can be caused by poorly designed or badly serviced electromedical apparatus. Talking about the severity of shock, the greater the current which passes through the body, the more severe is the shock. So it depends on the magnitude of the current, and secondly it also depends on the path taken by the current. Like if it is passing through head, neck, heart or whole body, it might prove fatal. So shocks, they are more severe with alternating current than the direct currents. Talking about the effects, a minor shock, it leads to fright and distress, whereas the severe shock, it can lead to fall in the blood pressure and sometimes loss of consciousness. In extreme cases, there could be cessation of respiration, which may be accompanied by the cardiac arrest due to ventricular fibrillation, which is resulting from the electrical stimulation of the heart. So cessation of the respiration is recognized by lack of respiratory movements and cyanosis, cardiac arrest by absence or abnormality of the respiratory movements, and absence of pulse in the carotid artery and fully dilated pupils. So these could be the effect if it is a major shock. Talking about the treatment for the minor shock, we have to disconnect the victim from the source, switch off the current immediately, reassure the patient and allow to rest. Always give cold water to drink, avoid the hot water as it can cause vasodilatation and sweating, which can lead to further fall in blood pressure. Also the tight clothing should be loosened up and plenty of air is allowed. But if it is a severe shock, then the victim is laid flat and allow easy breathing. We have to loosen the tight clothing, provide adequate ventilation, and if the patient is unconscious, we have to summon mouth to mouth breathing or mouth to nose breathing method is used, and or we can use a bag, or ambu bag can be used for providing the air during the breathing process. And in event of cardiac arrest, cardiac massage must be applied in addition to the above, and we have to call for medical help immediately. Now talking about the causes, first is that sudden increase in current during the treatment, maybe because machine was switched on with controls up, or sudden appearance of pulsed current with the intensity high, or the patient have touched the machine. Talking about the precautions, the apparatus and connections, they should be tested before use. The controls should be at 0 before switching on any modality. Then provide adequate warm up for equipment if needed. We have to instruct the patient not to touch the apparatus, and the service of the apparatus has to be done on the regular basis. Next is the earth shock. So when a shock is due to the connection between the live wire of the main and the earth, it is known as earth shock. So connection to live wire can occur when wire is not properly insulated, when the live wire is not disconnected, when the switch is put on neutral wire, or the live wire touching any metal casing, or any wet thing is touched with the live wire. And connection to the live wire can occur when we are touching any conductor, when we are connected to the earth, or the metal casing on apparatus. So we have to properly arrange the physiotherapy department with insulating materials, proper flooring with insulating material, and it should be kept dry, and patient should not touch the apparatus. Metal casing of all apparatus should be connected to earth, and better to use the wooden furnishings. So this is a summary of electric shock, where we can see the electric shock. It is a painful stimulation of sensory nerves caused by certain flow of current, cessation or pause of flow of current, variation of the current passing through the body. Causes could be poorly designed electromechanical apparatus, improper insulation of the equipment, improper insulation of wires, any badly serviced medical equipment, mishandling of apparatus, improper guidance to the patient, and lack of proper safety measures. And severity, in accordance with Ohm's law, resistance is inversely proportional to current. So if the resistance of the skin is lower, the greater current will be passing through the body, and therefore it exposes the part of the circuit when it is touched with the wet hands. So the shock is more likely to be severe than if the hands are dry. And secondly, the greater the current passing through the body, the more severe is the shock. And thirdly, the severity also depends upon the path taken by the current. So strong current through the head, neck and heart proves to be more fatal. Then the severity also depends upon the type of current which passes through the body, and individuals can be electrocuted by using apparatus of as little as 40 volts direct current in industry. So types of electric shock: first is the minor, and second is the severe or the major electric shock. Minor does not have any major effects. It just the patient or the victim gets frightened and distressed. There is no loss of consciousness. But in the major or severe electric shock, there is fall of blood pressure, patient may become unconscious, and there could be a cessation of respiration followed by ventricular fibrillation and cardiac arrest. And they could be diagnosed by seeing absence of pulse in the carotid artery and with fully dilated pupils. Treatment is simple, that the current should be switched off immediately. Victims should be disconnected from the source of supply. If there is no switch in the circuit, the victim must be obtained from the contact with the conductor. But the rescuer also have to take care not to receive a shock himself from touching the affected person. So following a minor shock, patient has to be reassured that everything is alright and he should be allowed to rest. Water may be given, but hot drinks are avoided. Tight clothing should be loosened, and we give plenty of air is allowed. Then respiration, if the respiration is ceased, we have to go for CPR. Cardiopulmonary resuscitation have to be given. Oxygen therapy may also be administered if required, and the patient has to be shifted to hospital after the primary care. Thank you.